Radhe Radhe. This is a dysphagia notes from my side. If you like these notes, then let's understand this.
Hello, good morning. Today our topic is the dysphagia. Dysphagia means the difficulty in the swallowing. Now, patient come with the complaint of the difficulty in the swallowing. Now, first we have to differentiate dysphagia from the two differential point like the odynophagia and the global sensation. Now, what is global sensation? Then the global sensation is the anxious people feels a lump in the throat, but without any organic cause, but without any pathology they feel the throat in the lump, so that they people think that there is a difficulty in the swallowing. Now, what is the odynophagia? The odynophagia means the painful swallowing. Now, during the swallowing there is the pain. Now, it is the most commonly seen in the GERD or the candidiasis of the esophagus. Now, we see the causes. Okay, now the two causes, the most common causes and the rare causes. Now we first see the common causes. So the most common cause is the GERD, gastroesophageal reflux disease. Now second is the carcinoma of the esophagus. Then third most common is the foreign body of the esophagus. Foreign body in the esophagus, it is the most, for example, coin, bone piece, denture. It is the most commonly seen in the children. So first three are the most common. Now carcinoma of the esophagus, not only the carcinoma of the esophagus but the carcinoma of the all the upper respiratory organs, for example the pharynx, tongue, all the carcinoma leads to this dysphagia like the symptoms. Now another cause is the corrosive stricture. So there is a stricture formation. Now another cause is the mediastinal node. All these are the extraluminal causes like the mediastinal nodes, secondaries, and the lymphoma, tuberculosis, aortic aneurysm, rolling hiatus hernia. This means the hiatus hernia. This also leads to the dysphagia. Now the thyroid enlargement, congenital anomalies. Okay, all these symptoms are also leads to a dysphagia like the symptom. Now we see the most rare causes of the dysphagia, but not the negligence these causes. So we see the rare causes. First, the diffuse esophageal spasm. Now any damn causes leads to the esophageal spasm, then automatically it leads to the dysphagia like the symptoms. Now thyroid swelling. Then neurological causes like any cause like the stroke, bulbar palsy, motor neuron disease, Parkinson diseases. All these are the rare causes, but yes, in this occur the dysphagia. Now the congenital anomalies. Now anomalies that from the congenital of the esophagus. Now drug induced also dysphagia, and the mediastinal fibrosis also leads to the dysphagia. Now we see the symptoms of the dysphagia. So the first, dysphagia already is a symptoms, but what are the narration from the patient that we are so first is the difficulty in initiation of the swallowing. Then complaint of the choking. Patient complains that I feel choke in the throat and the nasal regurgitation of the food and the tracheal aspiration. All these are the most common. There is also a drooling, dysarthria and hoarseness. These are symptoms due to the any cranial nerve and other neurological signs may be present. Then the swallowing of a liquid is the normal until the strictures become the extreme. मतलब कि जब तक स्ट्रक्चर एकदम एक्सट्रीम नहीं होगा तब तक लिक्विड स्वैलो करने में कोई डिफ़िकल्टी नहीं होगी, लेकिन जैसे स्ट्रक्चर एक्सट्रीम होगा तब दोनों डिफ़िकल्ट करने स्वैलोइंग करने में डिफ़िकल्टी आएगी, लाइक द सॉलिड एज वेल एज द लिक्विड. Now we see the investigation. The most common and widely choice of the investigation is the endoscopy, because endoscopy allows the बायोप्सी एज वेल एज द डायलेटेशन ऑफ द स्ट्रक्चर. मतलब कि उसके साथ एंडोस्कोपी के साथ ही बायोप्सी भी हो जाएगी और जो उसकी ट्रीटमेंट है डायलेटेशन ऑफ द स्ट्रक्चर वो भी हो जाएगा. इसीलिए एंडोस्कोपी इज़ द फर्स्ट चॉइस ऑफ द इन्वेस्टिगेशन. Now other investigation may there is a chest x-ray. So why we doing the chest x-ray? So chest x-ray shows mediastinal mass lesion and the foreign body. If any children having swallowed any foreign body, then we saw in the chest x-ray. Then barium swallow. It is also most common. The so the irregular feeling defect or the extrinsic compression, any outside mediastinal mass होगा या any damn thing, then we find out from the barium swallowing. Now the last part is the treatment. Treatment depends upon the cause, like the modified the Heller's myotomy, esophageal resection, उतना भाग हम कट कर देंगे, और डायलेटेशन, वो जो भी स्ट्रक्चर है वो उसको हम डायलेट कर देंगे, एंड द फॉरेन बॉडी.
In last, we see the summary of the dysphagia. So let's start. Dysphagia मतलब कि कोई भी patient come with the complaint of a difficulty in this initiate of the swallowing, choking sensation or any aspiration, regurgitation like the symptoms. So we first rule out by the endoscopy or video fluoroscopy. In short, the barium swallowing. So now in the endoscopy, result shows three possibilities. First, stricture, then esophagitis, and the dysmotility. So if there is present of the stricture, then we rule out it is a benign or a malignant. So in benign stricture, rule out the peptic fibrous rings, then the esophagitis, eosinophilic esophagitis, and any drug induced. And if then there is the malignant, then we rule out any carcinoma of the esophagus, carcinoma of the stomach, and the extrinsic any compression. All these causes we saw in the causes of the dysphagia, but from the investigation we rule out okay, it is the benign or any malignant stricture. Okay, most common and the 99% there is the stricture, but there is also esophagitis and the dysmotility is also present. So in the esophagitis there is the peptic cause, then any candidiasis or the eosinophilic. In the dysmotility there is a we rule out again from the barium swallowing, any achalasia, cardia, any non-specific motility disorder. Okay, now in the second investigation from the barium swallowing, we saw we saw any neurological disease, for example the bulbar palsy, pseudobulbar palsy, and the myasthenia gravis. All these causes we rule out from the most common the two investigation, barium swallowing and the endoscopy. So thank you so much. If you like this video, then please like, share and subscribe and support my channel. If any doubt, then please ask me question in the comment box, and thank you so much to listening me.